Hello, it's Dr. Rhonda Johnson, and today is Friday, January 29th, 2021. Well, I'm going to be talking about two topics today: COVID disease in children, and then a summary of what's been going on with this pandemic in our first month of 2021. Well, first about children. Now, that news is not so good. More children are testing positive for COVID-19, folks. The month of January saw a record number of children in the United States who tested positive with COVID, according to the American Academy of Pediatrics and the Association of Children's Hospitals. The week of January 15th, more than 211,000 COVID-19 cases were diagnosed in children and teens, the most in a single week since the start of this pandemic. So these cases now in children and teens total to over 2.68 million, again, according to new data from the American Academy of Pediatrics and the Children's Hospital Association. Children make up a total of 12.6% of all cases here in the United States, and at least 10,000 children and teens have been hospitalized since the start of the pandemic, and sadly 191 have passed away. Now, data is not available from all states, but preliminary data indicates that African American and Latinx children make up the majority of children who have died from COVID-19. So parents, please keep track of your children. Make sure they're doing the same preventive strategies that we do in adults. I know it's hard. I know it's tough. Unfortunately, children don't get as sick, but the number of cases of the MIS-C, the multi-system inflammatory complex syndrome, have increased in children as well. So you just have to be very mindful and be sure that you know the symptoms of both COVID-19 and MIS-C. Now I'm going to switch to summarizing this first month. The Wall Street Journal did an article, and they reported that through Wednesday of this week, there have been 83,240 people who have died in the month of January. This surpassed even September, which was a record, December rather, of 77,486 deaths, according to data from Johns Hopkins. And we know that nationally, a total of over 433,000 people have died since the start of the pandemic. And folks, there are 2 more days left in this month. I did some analysis of data that's reported from the CDC, and there were over 5.3 million people infected with COVID-19 between January 1st and January 28th here in the United States. So folks will be seeing another record number of deaths in February. And this is getting hard to swallow, that's for sure. Now, there is some good news on the horizon. There were over 48 million doses of COVID-19 vaccine distributed, and more than 26 million of those doses have been given as shots in the arms. We've heard updates that the vaccines are overall well tolerated. There have been less than 50 cases of severe anaphylaxis, that's the life-threatening allergic reaction, in both the Moderna and the Pfizer vaccines, and around 100 or so of serious allergic reactions. And many of these people have a history of allergic reactions. Now, no deaths have been confirmed. I believe there are 3 deaths that they are investigating, 2 in California and the 1 doctor in Miami. Now, not so good news that we've learned this month, that there are these multiple variants of this virus that are documented in the United States that have arrived here. These variants are believed to be more contagious. There's the UK variant, which is believed to be 70% more transmissible and may be associated with the increased risk of death. There's the South African variant that was discovered here this week in 2 people in South Carolina. It shares mutations with that UK variant, but it's believed that these current COVID-19 vaccines are going to be less effective, but still effective against the South African variant. And then there's this Brazil variant, P1, that contains a bunch of mutations that may hide it from antibodies. It may impair with its ability to be recognized by antibodies. And that virus is also here, that virus variant. So again, we'll just have to see how this goes. But the recommendation now is when you're out in public that you double mask. You put a disposable mask in with your cotton mask or your gator mask, or double up on your disposable mask. Now, in this month also, there's good news coming from Johnson & Johnson. This vaccine is also going to be called the Janssen vaccine. They partner with Janssen Pharmaceuticals. This is the 1-dose vaccine with the adenovirus vector. It doesn't contain the messenger RNA. And it's showing good protection. Protection in the U.S. was around 72%, 66% in Latin America, and 57% in South Africa, the country that has the most cases of the South African variant. And the government has purchased 100 million doses of this Johnson & Johnson vaccine to be delivered by the end of June. So that's encouraging. This month of January, we had an insurrection, an impeachment, and an inauguration. All in 1 month, folks. And we have a new plan in place to control the pandemic. Thank goodness. This plan involves smarter testing, faster vaccinations, and a plan to make sure that the vaccine is distributed equitably amongst all people. And it's 200 pages. It's available online. You look for President Joe Biden's COVID-19 plan. And it was released the day after inauguration on January 21st. We've also seen just this past month vaccine chaos. People jumping in the line. Short supplies. Long lines. I remind myself that it's just been 9 days since the new administration took office, and that I have to have patience. Things will get better. I certainly have hope because of the vaccine. More than ever, we have to practice prevention because of these variant strains that are more contagious. And I have seen relief and felt relief because I have a lot of physician friends who have gotten their 2 doses of the vaccine, and not a single one of them has reported any major side effects. They've been able to continue working, just experienced a little bit of muscle soreness in their arm. Some of them have felt tired. Some of them haven't felt a thing. So I feel relief. So that's a long month's worth of progress, but at the end of the day, we still have a lot of way to go. And folks, I hope you'll continue to be safe as we head into February. And maybe February will have a different story at the end of the month. I have hope. This is Dr. Rhonda Johnson. My views are my own. Take care, folks, and have a blessed day. And I'll see you next month. All right.